are you Mrs. Smith?
Yes.
My name is Leah Bradshaw. I'm a nurse practitioner student. What are we seeing you for today?
Just a physical.
Okay. So with the physical, I'll do a review of systems and then the full head-to-toe assessment. And we'll start with your general. Have you had any kind of fatigue or any kind of weight loss greater than 10 pounds recently?
No.
Or weight loss greater or weight gain greater than 10 pounds?
No.
Okay. So we'll start with the head. Have you had any kind of trauma before or vertigo?
No.
Any kind of memory loss?
No.
Have you noticed any kind of lesions, rashes?
No.
Okay, so we'll start with the hair. So we'll look at the hair for distribution and quality and texture. We'll look at the scalp, and you'll want to look in different areas for any kind of scaliness or lesions. And then we'll look at the skull for the size and contour and symmetry. We'll look all around for that. And then the face, we'll look at the facial expressions, any kind of involuntary movements and symmetry, and then the skin for discoloration or lesions. And then you want to palpate the skull for any kind of masses or tenderness or lumps. Is anything tender?
No.
Okay. And then we'll test cranial nerve 7, which is the facial nerve. If you can puff your cheeks for me and smile and frown, raise your eyebrows and close your eyes real tight. Okay. And then we'll look at the TMJ on both sides to look for any kind of swelling or redness. And they both look okay. So then you want to palpate for tenderness, swelling. And then if you can open and close for me, you want to check to make sure that there's no clicking. And then we can test cranial nerve 5. At this point, if you can clench your cheeks together or your jaws together. And then we'll test facial sensation. So if you can close your eyes for me and say now, anytime that I touch you.
Now. Now. Now.
Okay. And the neck, we'll look all around for any kind of masses, swelling, and any kind of lesions, and none are noted. And have you had any stiffness?
No.
And how's your smell been?
It's been good.
Okay. So with the neck, you look for symmetry, scars, or masses. You look at the trachea for deviation. If you could swallow for me. And then the thyroid gland, if you can swallow again. And it's symmetrical on both sides. And then you want to palpate the lymph nodes. So you'll palpate the for size, shape, tenderness, consistency. So we palpate in front of the tragus, post-auricular, the base of the skull, and then down to the inferior jawline, and then the sternocleidomastoid, the anterior and posterior. So then we'll palpate the trachea for deviation. So we'll deviate to one side. And there's no deviation present. And then the thyroid gland will come behind. Make sure that there's no masses. And look at the size. Okay, so then we'll look at the cervical spine for tenderness, or palpate for tenderness, and then palpate the cervical muscles for any tenderness or spasms. So then I'm going to listen to the thyroid gland. And this is usually if it's enlarged, we'll just check the bruise. Okay. And then we'll test the neck range of motion. If you can put your head forward for me, backwards, to the left, to the right, then touch your right ear to your right shoulder and left ear to your left shoulder. Okay, good. So with your ears, have you experienced any deafness?
No.
Any ringing in your ears?
No.
Any pain?
No.
Is your balance good?
Mhm.
Okay. So then you'll inspect the auricles for deformities, masses, skin lesions, and we'll check both sides. And then we'll do the otoscope exam to look at the inside for the ear canal to check for redness, swelling. And we'll look at the eardrum to make sure everything looks clear and that there's not fluid behind the eardrum. And then you want to palpate the tragus and the auricles. And then the mastoids for any tenderness, nodules, or edema. So I'm going to do a whisper test, and this is cranial nerve 8. This is to check the acoustic. So if you can close that ear over there for me, and then just repeat what I say.
1, 2, 3,
Okay, and same on this side.
4, 5, 6.
Okay. So then we can do the Weber and the Ron test, and we would take our instrument and hit it, and she would feel vibration on both ears equally to have a good result for that test. And then the Ron test, we would hit the same instrument, put it on the mastoid bone, and check until she didn't feel the vibration anymore, and then put it in front of her ear to see if she hears it. And the hearing should be 2 times longer than the vibration. So with the nose, any kind of discharge, obstruction, difficulty smelling,
No.
any nosebleeds?
No.
Okay. So we'll inspect the external surface for any kind of lesions, for symmetry, any kind of deformity, and we'll look on the inside of her nose with a light and a nasal illuminator. And you want to look at the mucosa for color, swelling, any kind of exudate, ulcers, polyps, the septum for deviation. Okay. So then we can trans-illuminate the sinuses. So then we would do that under this side and look up here. Same on this side. And then if you can open your mouth for me. Okay. And it should be clear on all sides. You want to palpate the nose for tenderness and the frontal and the maxillary sinuses. Any tenderness?
No.
Okay. So then we'll check for cranial nerve 1, which is the olfactory. So if you can close your eyes and then hold one nostril closed and tell me what you smell.
Coffee.
Okay. And close the other side and then tell me what you smell.
Hand sanitizer.
Okay. Thank you. So with the mouth and pharynx, any kind of soreness, ulcers, bleeding,
No.
any throat pain, everything tastes okay.
Mhm.
Okay. We'll inspect the lips for the color, any kind of lesions or cracking, and then if you can open your mouth, you want to look at the oral mucosa for redness, pigmentation, ulcers, any kind of white patches. Look at the gums for color, swelling, ulcers. And then we'll look at the teeth for any caries or abnormal positioning or any missing teeth. You look at the hard palate for color, lesions or masses, and look at the uvula for the soft palate. If you can stick your tongue out and say ah. And we'll look at the symmetrical movement of the uvula. And we looked at the color, ulcers, swelling of the tonsils, and the symmetry in the pharynx if there's any kind of lesions present. So then say ah for me. Okay. So we just tested the gag reflex, and that's cranial nerve 10, cranial nerve 9, the movement of the soft palate we just seen, and the gag reflex, and can you swallow for me? And she has good swallow. Cranial nerve 12, tongue movement, so if you can stick your tongue out for me, move it side to side. Okay, and we can also see around the tongue for color, texture, and then if you can push your tongue up against my finger, and we'll test the strength. So, with your eyes, have you ever had any vision loss or trauma?
No.
Do you wear glasses?
No.
Okay. So the lids will look at discoloration, lesions, masses, any kind of edema. The lacrimal apparatus will look at the swelling or tearing, and then we'll look at the conjunctiva and the sclera. If you can look up for me, we'll look at the color of those. And then we'll look at the irises for the depth of the anterior chamber, and then opacities. And then cranial nerve 3, 4, and 6 is the 6 cardinal gazes, and we watch for ocular or extraocular movement. If you can just follow my finger with your eyes. And then the Rosenbaum chart. If you can read or close one eye for me and read those letters for me.
LNQR.
Okay, and now close the other eye. Do the same thing.
LNQR.
And now with both eyes, read that.
LNQR.
Good. So we'll do the visual screen. So tell me when you see my fingers.
No.
Okay.
No. No.
Okay. So close this eye and tell me when you see my fingers. Or look straight ahead. Sorry.
No.
Okay. Other side. And look straight ahead.
No.
Okay. And then we would do a color vision test. And we can do a special test to uncover the eye. So just cover one eye for me and uncover. Okay. And now other eye and uncover. Okay. And then a version of the lid, and you would push on the lid to avert the lid, and then the ophthalmoscope will darken the room, and then if you can look at the object in front of us, we're going to look at the retina and the fovea and macula and the optic disc for color, clarity, symmetry, any kind of hemorrhages. Turn the light out. So you want to go 15 degrees. Look at the eye. So cardiac, have you ever had a history of chest pain, palpitations,
No.
difficulty breathing, any kind of edema in your legs?
No.
Okay. We'll inspect the jugular and venous pressure if you can turn your head for me, and then turn it to the other side. Okay. And then the point of maximal impulse, if you can pull your shirt up just a little bit for me. Okay, we'll look at the point of maximal impulse there, and then assess the amplitude of the carotid pulse one at a time. And we'll palpate the point of maximal impulse. And then we'll palpate the left sternal border and the third and fifth intercostal space for systolic pulse. And then we'll palpate the pulmonic area, or the pulmonic area on this side, and the aortic area. If you can't palpate the PMI, then you want to percuss the left border of the cardiac. And then we'll auscultate for bruits. You look up for me. And then we'll listen with the diaphragm, the aortic, pulmonic, tricuspid, and apex. Then you want to listen at the apex with the bell, or S3, S4, or any kind of murmurs. And when you do that, you want to note the rate, rhythm, the intensity, the timing, and if you hear any murmurs, you want to make sure and document the document it completely. So respiratory, have you had any difficulty breathing, shortness of breath,
No.
any coughing, wheezing, any kind of pain?
No.
Okay, so we want to look at the general appearance when she's breathing. We'll look at the rate, the rhythm, the depth of her breathing, any kind of accessory muscles used or any retractions noted. The thorax, you want to look at the symmetry and any kind of deformities all around. And then you want to look at the anterior, posterior diameter compared to the lateral diameter, and assess symmetry and movement when she's breathing. And then you want to palpate for any kind of areas that she reports any pain. Then you want to test for chest expansion, and you place both hands on the back and then ask to take a deep breath and look at the equalness or the symmetry of the movement of your hands. The test for expansion, the symmetry of expansion. And then we'll perform tactile primitus. So if you can say 99,
99, 99, 99,
and you can do it anterior too.
99, 99, 99.
Okay. And then we'll want to percuss on both sides. And percuss for diaphragmatic excursion. And then we can auscultate. Take a big breath for me. And you want to listen for any adventitious sounds, or crackles, wheezes, ronchi. Breathe for me. The spinal, any kind of arthritis, or joint stiffness, swelling, muscle cramps.
No.
So we'll want to look at the position in the neck and look at the posture and assess the cervical, thoracic, lumbar curves for convexity and concavity, and assess the straight line from C7 through gluteal cleft, and the alignment of the shoulders and iliac crest. So if you can stand up for me, and then bend over, and we'll look at the symmetry of her shoulders and the iliac crest. Okay. And then if you can walk for me from there to here, and we'll assess the gait. Okay, and can you walk on your tippy toes? Okay, and then when you walk back, walk on your heels. Okay, and you can have a seat for me. So any tenderness?
No.
So you want to palpate the spinous process, the cervical facets for tenderness, the paravertebral muscles for tenderness or spasms, the sacral joints for tenderness, and then we'll percuss. Let me know if you have any tenderness. So then we'll test cranial nerve 11. If you can raise your shoulders up against my hands and then push against my face, or push your face against my hand. So if you can lay down for me, we're going to do the abdominal exam. Any kind of appetite change,
No.
nausea or vomiting,
No.
constipation, difficulty peeing,
No.
any incontinence or blood in your pee or stool?
No.
Okay. So we'll look at the abdomen for symmetry, the contour. I'm going to lift your shirt up a little bit. Any kind of scars, we'll look at the umbilicus for inflammation, bulges, any peristalsis or aortic pulsations. And then we're going to listen to bowel sounds. And then we'll listen for bruise over the aorta and the renal arteries. And the iliac arteries. And then we'll listen for venous hums over the spleen and liver. So we're going to percuss for tympany and dullness. So we're going to measure the span of the liver, starting at the chest. Okay. And then we'll assess for splenomegaly. Can you take a big breath for me? Okay. So then we'll palpate with light tenderness or any kind of guarding or superficial masses. And then deep tenderness or deep palpation for any kind of tenderness or masses. And then we'll do rebound tenderness. And we'll look at the liver edge. And the spleen. Take a deep breath for me. And then we'll palpate the kidneys. And the aortic width. And we'll look for any CVA tenderness. And then for the lower extremities, we'll assess for symmetry, swelling, any kind of deformities, abnormal positioning. Then we'll palpate the bony landmarks. And then we'll do the upper extremities. And we'll test range of motion. If you can lift your arms straight up for me. Okay. And then put them back. Okay. And then pull them out. And then pull them in. And then do like 90 degrees and lift them up. Okay. And then we'll look at the elbow. We'll palpate for any tenderness. Okay. And then if you can flex and extend, and then turn your hands like this, and turn them like that, in the supination and pronation. And wrist and hand, we'll palpate the wrist. And then, so can you flex, extend, and then turn in, turn out. Okay, and then we'll look at the thumb and fingers range of motion. So if you can pull your thumb across to your fifth finger, and then pull it out, move it out and in, just your thumb, and then touch each finger with your thumb. And then with your fingers, make a fist, extend up, and then pull them in and push them out. Any kind of leg pain, cramps,
No.
stiffness.
No.
Okay, so we looked at the knees, and then we'll look at the ankle and feet for any kind of deformities. So then we'll assess the range of motion. You can lay back for me, and then put this knee to your chest, and then other knee, and then if you can push this leg this way, straighten your leg, and then pull it this way, up, okay, and then straighten both legs, and pull this leg in, and then we would do the posterior drawer and then the extension, and then you can sit back up for me. And then, so put your leg out, in, and then kind of turn it to the side, each side. Same with that one. Out, in, side. And then the ankle and foot will want to, I've already palpated that, so then if you can do dorsal flexion, then plantar, dorsal, plantar, and then turn it in, turn it out, turn it in, turn it out. So with the full head to toe assessment, we want to look at the color, any kind of cyanosis, jaundice, her skin temperature, if she has any lesions while we're doing our assessment. But other than that, everything looks great, and I think you're good.
Thank you.